So I want to talk today about pelvic health, a very important part of our body. It's in the center of our body. If it is not in balance, if one side's up too much or too forward or possibly both, then you're in a torsion. That's going to put undue tension on the knees and the feet, and people wonder, why do my feet hurt? Well, all that tension could be coming from the pelvis. Also, the feet could have dysfunction. Maybe you're walking barefoot and all of a sudden you step on a pebble and you're like, ouch, that hurts. And then the bone or some other tissue goes into contraction, and then that pulls down on the calf muscle and then on the hamstring muscle, and then all of a sudden on the bone, the ischial tuberosity, and now your pelvis is out of balance. So there's so many things that can make our pelvis go out of balance and make it not healthy. So this small model of the pelvis shows us the pubic symphysis joint and the sacroiliac joints in the back. This is the sacrum, and there's technically the coccyx, which is 3 segments of bone that come down to be the tailbone. So the sacrum interacts with this ilium. So I wanted to show you on this model, when we walk, all of these joints should move like this. So if you look, our tails should be wagging like a dog's tail, really and truly. So if you look at the front of this model, if the bladder sits right here behind this pubic symphysis in this bone, it oftentimes gets stuck to the bone, and there's a gentle myofascial release we can do to gently have that come off. But think of it if it's stuck. If that tissue is stuck to that bone, only the back joints are trying to move, not all of them. So this is like, think of a model walking down a runway and they have all that move in their hips. If any of these joints are stuck, they will not be able to do that. That's optimal movement when we're wagging our tail. So pelvic health, if this is working well, then the bladder, on women, the uterus, on men and the prostate, all of this has the ability and the possibility of functioning better if everything's not stuck to it. So pelvic health is anything in this pelvic bowl, right? So think of this as a nice bowl here, and what's housed here is the bladder. And for women, we've got the uterus that's back in here, and then we've got the intestines. So the large intestine, you always see that picture of the large intestine coming up here, belly button's about here, and then all the small intestines. So this right here houses so much of our digestive system and reproductive system. The kidneys would be sitting right about here and have the ureter that comes down to this area, and it's in the back, right? And then the psoas muscle coming down here, that ureter goes right across that psoas muscle and comes to the front where the bladder is and dumps right into the top of the bladder. So our psoas, our poor psoas, gets blamed for so many things, and that it's too tight and to this and to that. But if this ureter is stuck to that muscle, the brain sends a signal all the way down here and says, hey, you muscle there, that ureter has some dysfunction. Could you like tighten up and protect it? Right? So it's putting on a protective mechanism, but now all of a sudden that ureter's stuck and the psoas refuses to move, and it messes up your low back, and now your pelvis is out of balance, and the psoas gets blamed for it, and it's really possibly a ureter issue, right? So in pelvic health, when I work with someone having been trained on the veins and the arteries and the nerves and the tendons and the ligaments and the organs and the fascia around the organs, my tendency is to figure out and ask in various different ways, ask the body that I'm working on, because everybody's different, what do you need in order to release? And you know, somebody with this ureter stuck to this muscle, it could be release the muscle and then the ureter will let go. It might be that the kidney's contracted because there's something wrong with it and it's pulling up on the ureter and then pulling tension on the bladder. So we have to fix the kidney first. Well, which comes first, the chicken or the egg? And that's my job as the detective, to figure out which system needs addressed first, second, third, fourth, etc. And in an hour session, I might have worked with every system in your body in various parts.